age and different production flows to control Actinobacillus pleuropneumoniae, or APP, on a farm-to-finish pig farm. Briefly, this report or this case relates to a case of a farm vaccination program for APP whose results were not good enough for the farmer, and this was mostly related to the poor management practices, including the delaying and the mixing of pigs. But to give you a little bit more of context, it's important to speak a little bit about APP. This is an important agent of the porcine respiratory disease complex. It has about 16 serotypes described worldwide, but some of them will have more relevance than others in regards to their virulence and so to their clinical presentation on farm, or the severity of this clinical presentation. So the least virulent serotypes are the ones that are most commonly found everywhere, so they are the ones that are endemic. And the different serotypes will have different virulence factors, which will be typically APX1, 2, and 3. In regards to the transmission, APP transmission is mostly nose-to-nose, and piglets may get infected by contamination due to the sows, the contact with the sows, and later on in life to contact with pigs that are shedding these bacteria. Prevention is the most important thing we can do to combat APP infections. It's through good environmental conditions, proper ventilation, low ammonia levels and dust levels, and so on. These will be the ones that we need to control to prevent bacteria to cause damage. Vaccination will be able to control some of the clinical presentations that are the most severe ones on farm, so it will attenuate some of the lesions we have, especially pleurisy lesions, and many farmers end up not solving the problem but controlling some of the problems they have on farm through antimicrobial usage, which is by far what we want to prevent now the most. And so our case farm had an APP vaccination protocol in place, or they had one that was implemented a year before our farm visit, because they indeed had a very severe clinical presentation of APP on farm, and they wanted to control some of these and remove some antimicrobials in feed they had with the finishers. And the farmer was not happy with the way things were going, because he said it was vaccinating twice the pigs was lots of labor, and the costs were also high without seeing the results. And when we have a problem like this is when we go and try to understand why is it that the vaccination is not working properly as it should. There are different ways why this could be, but one of them is a vaccination timing. And when we think of the ideal vaccination timing to vaccinate on farm, we usually have into account, or we usually think that there will be an all-in all-out flow, that pigs will have the proper age as to where they are in the farm. But if we have some mixing and some delaying of pigs, some of the pigs that are in week 7 may actually be 8 or 9 weeks old, and so they will not be vaccinated at adequate timing. This is what this case is about. And so our case farm is a farm-to-finish Irish pig farm with 600 sows, with a batch system of 1 week, and it's located in the south of Ireland. This farm has the flow that is illustrated in this slide. So pigs are weaned at 5 weeks of age, and then they are in weaner stage for 4 weeks. After that, they will be in the grower stage for 4 weeks, and then finish off in the finishers for about 10 weeks. When they reach 23 weeks of age, they will be about 105 kilograms. The vaccination protocol for the piglets on this farm starts with Mycoplasma pneumoniae at 10 days of age, and then a second shot at weaning. These pigs are also vaccinated for porcine sarcovirus type 2 at weaning. And finally, they are vaccinated for Actinobacillus pleuropneumoniae at transfer, so between weaner and grower at 9 weeks of age and 10 days after. So as I said before, this case had a history, or this farm had a history of 30 to 40% of pleurisy, which led the farmer to use antimicrobials in feed to control this problem. and this then was trying to be prevented through the introduction of an IPP vaccination on farm. This had happened about a year before our initial farm visit, and even with this introduction of vaccination on farm, the pleurisy lesions were reduced, but they were still affecting about 15 to 20% of the pigs. And there were still some sudden deaths in the grower stage, 12 to 15 pigs per batch, which was still a considerable proportion of the pigs. And the farmer, with these results, he was not satisfied with what was happening, and he was considering to stop the vaccination for APP. So overall, the poor results of the vaccination, the labor and the cost involved were making him were making him wondering if stopping the vaccination would actually be better for him and not that much of a difference for the pigs. When we visited the farm with the veterinarian of the herd, we investigated what was going on, and we interviewed the staff, and these suggested that there were some delaying of poor-doing pigs, which were then mixed with younger batches, so they were kept from the normal production flow. We also checked the fridges to go through the normal checks that we have to do whenever there's some sort of vaccination failure, and the medicines where the vaccines and the medication were kept, they were checked and they seemed to be okay. And the staff seemed to be informed and seemed to know what are the correct administration procedures for vaccination. We also checked 2 of the pigs that were recently dead on the farm, 17 and 18 weeks of age, and they both presented dark lung consolidation and fibrinous pleurisy, which is compatible with the clinical picture of Actinobacillus pleuropneumoniae, and so confirming our previous diagnosis. So we decided to proceed with some more investigation so we could see what was happening on the farm. And the first thing we did was checking the seroconversion timing of these pigs. So we did a cross-sectional study where we took blood samples from pigs of different ages in one day, and then we checked their antibody profile. We also went to the slaughterhouse to check what were the pleurisy levels at that time in these pigs. And finally, we decided to proceed with a small follow-up trial where we would be examining the efficacy according to the vaccination timing. And so the first 2 would be just to check what's happening on the farm, and the third one, it's a little bit more of an investigation to see why the vaccination was not working properly. To give you an idea of how all of these events unfolded, you have here the outline of the events. You can see that the vaccination started in 2016, and the first farm visit we did was in September 2017, where the blood samples for the cross-sectional serology study were taken. Then with the follow-up study, that started in February 2018, with pigs born over 4 days being tagged at birth. And then we also did in February 2018 slaughterhouse investigations to check the pleurisy levels. These pigs were weaned 5 weeks later, and they were bled just before and after the vaccinations. So the first bleeding was at 10 weeks of age when pigs were vaccinated, and the second bleeding was at 14 weeks of age, 2 weeks after the second vaccination. Finally, these pigs were followed until the slaughterhouse in August 2018, and then we did a careful examination of their lungs so we could check what was the efficacy or the effect of the vaccination on pleurisy levels at slaughter. So these are the results of the cross-sectional study we did on farm, and we used the IDEX ABP APX4 antibody test, and APX4 is a toxin produced by APP which is specific to these bacteria, and we see that at 10 and 12 weeks of age, 62.5% of the pigs were positive to APP. After this, the antibody levels decrease, and the pigs at 16 weeks of age seem to be completely naive to APP at this stage. And then at the same time, we looked at the pleurisy lesions at slaughter, and there was between 17 and 30% of pleurisy lesions. So it's still a quite high proportion of pigs affected, despite the fact that they were being vaccinated at this time. And so to investigate a little bit more what was happening with the vaccination on farm, we did this follow-up study where we followed 495 pigs at birth, and we tagged them at birth. And at vaccination, we formed 3 groups. The first group was an optimal timing for vaccination, so pigs that were vaccinated at 10 weeks of age. The second group were a group of pigs that were vaccinated later, so they were delayed from their normal flow, and they were vaccinated at 11 weeks of age or 12 weeks of age. And then we also had a cohort of pigs that were not vaccinated, so they were the control pigs. All of these pigs were blood sampled just before the vaccination and after the vaccination at 14 weeks of age, and the same IDEX kit was used to test these blood samples. So here are the results of the follow-up trial we did, and we can see for each one of the groups that we did, we compare their SP levels and ELISA tests before and after vaccination. And what we see is that before vaccination, there were no differences found in the sample to positive values between the different groups. But after vaccination, we see that the optimal pigs here were higher than control, so that we actually can compare this blue group with this one, and there is a significant difference between the level of antibodies between this group and the control group. After vaccination, the optimal SP values also were higher than the controls, as I just mentioned, but they tended to be different, to be higher compared to the delayed group here, even though this was not, this was at P.088. And no differences were found between the control and the delayed, so between this group and this one after vaccination. When we followed these pigs to the slaughterhouse, unfortunately not all pigs got to the slaughterhouse because some of them died on farm, namely in the delayed and in the control groups. But we saw that the optimal pigs, the pigs that were vaccinated at an optimal timing, had 0% of pleurisy lesions, whereas the delayed group had 38% of the pigs affected with pleurisy lesions, and the control group had 35% of pigs affected with pleurisy lesions. So given these results, what we told the farmer was that he should definitely tag any pigs or groups which get delayed from their normal production flow, and that's what he did. So he should keep the pig flow under strict control at all times, and after implementing some of these changes, the pleurisy prevalence decreased to less than 5% within 6 months, and he was able to remove the antimicrobials from the finisher's diet, which was exactly what was pretended with all of this exercise. When we think of this case and we look at the reasons why vaccine may fail on a farm and why vaccination efficacy changes from farm to farm, we should look at multiple factors. And they start with the typical storage of these vaccines, how were they transported to the farm even, the technique of administration, the training given to the farm staff. Is there any new farm staff that hasn't been trained properly, which has been applying these vaccines to pigs? All of these are important, but we also should look at adapting the vaccination protocols to each farm. And at the same time, when we think of APP, management and best practices and or vaccination should always be used before any antimicrobial usage, because any antimicrobial we may use to control this problem will not solve the problem. It will just be remediating, it will just be controlling the problem in the pigs that are affected at the moment, but it's not going to prevent the problem in the future for other batches. So then when we go to the timing of the vaccination, this is key and it's often disregarded. We can think of that every time we think of applying a vaccination protocol on a farm, especially to a case like this, it's actually very easy to just go to the farm and do a cross-sectional studies to at least understand when should the vaccination be done, and then to talk with the farmer to understand if he's doing the all-in, all-out procedures properly, so he can know with certainty when is the vaccination applied and when is the best timing for this application. And so adapting these vaccination protocols to each farm is good practice and should be done more often. And so I thank you all. These are the references that I used for this clinical case. I'd like to acknowledge the attending veterinarian and the farm manager and staff. And thank you for your attention. I'm open for questions. Thank you very much.